Early identification of type 1 diabetes. Who might benefit from screening for autoantibodies? Identification and monitoring of autoimmune type 1 diabetes can reduce the risk of diabetic ketoacidosis at clinical diagnosis and allow individuals and their families or caregivers time to prepare for future disease management. General population screening, using combinations of genetic and autoantibody testing, has proved effective in identifying individuals who may have autoimmune type 1 diabetes. T1D screening was associated with a lower risk of DKA at diagnosis compared to individuals who were not screened. Genetic risk for type 1 diabetes can be inferred through family history. Having a first-degree relative with the disease confers a 10 to 15-fold higher risk versus the general population. Calculation of genetic risk scores can aid the selection of individuals in the general population who are at increased risk of autoimmune type 1 diabetes for islet autoantibody screening. However, it should be remembered that around 90% of people diagnosed with type 1 diabetes have no family history of the disease. An increased risk of developing type 1 diabetes has also been noted in people with a personal or family history of other autoimmune disorders, for example, celiac disease, autoimmune thyroid disease, and adrenal disease. General population screening, using combinations of genetic and autoantibody testing, can identify individuals who may have autoimmune type 1 diabetes. Candidates for autoantibody screening may also be selected based on individual and family history.